Community Action. I've been with Community Action for a little over 9 years. We cover housing programs in the following counties: Bedford, Huntington, Fulton, Mifflin, Juniata, Franklin, and recently some programs in Blair County. The programs that specifically provide assistance for homeless families are as follows. The Emergency Solutions Grant, it's commonly known as ESG. It can serve homeless individuals and families who meet HUD's homeless definition. With that, it would be anybody sleeping outside, anybody that's staying in emergency shelter, incarcerated for 90 days or less, and was literally homeless upon entry. We assist with security deposit, rental assistance, and that grant also allows us to serve at-risk individuals and families who are facing eviction within 14 days with rental and utility arrears. We have 2 Continuum of Care grants, which are also able to assist with security deposits and rental assistance for homeless individuals and families. Additional programs that we have include the Emergency Rental Assistance Program, commonly known as ERAP, which can help families with rental, utility, arrears, and forward assistance, and can provide assistance up to 18 months. We also have the Homeless Assistance Program and Fair Funding, which can assist with at-risk families. We have housing case managers in 5 counties, and we subcontract services in 1. With all of our programs, we provide case management and referral services. Our program, so how our process works is when a family is literally homeless, they can access our CoCs coordinated entry system, and they can do so by either calling 211 or contacting a coordinated entry access site in the community. For the counties we serve, we are a coordinated entry access site for Bedford, Huntington, Fulton. And what that means is if somebody's literally homeless, they can either call us or they can come into our office and we do an assessment with them. When contact is made, the family is assessed and then placed on what is called the by name list. Once on this list, a homeless provider will reach out and work with the family in a timely manner and as funding allows for each county. I was offered the opportunity to sit on an early Head Start Policy Council for Fulton County for a little over 2 years. Being on the Policy Council really opened my eyes to begin to see barriers that occur early in a child's life. Working within the CoC and housing programs, I am familiar with meeting with adults in the family, not often getting to meet with the children. Sitting on the council allowed me to hear parents speak who had children in the early Head Start program and allowed me to listen to instructors that went into the homes and heard firsthand what barriers the families may face. Most of the time, the major barriers would be housing, employment, and childcare. I was able to speak to the council on programs that our agency offered, and then was invited to a staff meeting for the early Head Start provider, which allowed me to let all the instructors know what programs we offered and to answer any questions that they may have. I believe that being able to sit on the Policy Council and bring the information provided to these meetings back to my staff allowed us to form relationships with the Head Start providers. We also make sure to attend all the Human Service Council meetings in each of our counties to share what housing programs we have that are being offered. And we also have a director of early Head Start and a family services manager for early Head Start sit on our Center for Community Action Board of Directors. I believe that by having a seat on each of those boards, it's provided each of our agencies insight and strengthened the relationship between each organization. I also co-chair the South Central Regional Homeless Advisory Board, also known as RAB, of the Eastern PA CoC, which includes 8 counties in the South Central region of Pennsylvania. With that being said, moving forward from a CoC perspective, I would like to see early Head Start and Head Start providers on the RAB meetings. For the South Central region, our monthly meetings are held on the first Thursday of every month at 10 a.m. and are held via Zoom due to COVID. If you are in a different region and would like to attend your local RAB meeting, please feel free to contact me. On March 2nd of next month, the CoC is providing a training on the educational rights for children, youth, and families experiencing homelessness from 10 a.m. to 12 p.m. The presenter for this training will be Jeff Zimmerman from Education for Children and Youth Experiencing Homelessness Foster Program, Region 7 Coordinator. Topics to be covered are rights of children in public schools when experiencing homelessness, addressing needs of students in public schools when experiencing homelessness, rights of students in foster care, provisions of foster care, introduction to establishing relationships across housing and education sectors, McKinley-Vento versus HUD homeless definitions. I sent the link to Olivia and she's gonna post it in the chat. At this time, I'm going to pass it over to Terry Cyberling, who works with Center for Community Action and is our ELRC 6 Implementation and Operations Coordinator.
Thanks, Tiffany. As Tiffany said, I'm the Implementation Operations Coordinator for the ELRC 6, and I work for Center for Community Action. I have a long history in early childhood, working in both childcare, Head Start, and now the collaboration and being a employee of Center for Community Action. In 2018, the Center for Community Action became the grantee here in our region for the Early Learning Resource Center, which spans 7 counties in rural southwestern PA. As part of this reorganization of the regional keys in the local Child Care Information Services program, Center for Community Action became the regional hub for both the Child Care Works, subsidized childcare, and the Regional Keys to Quality program, which is the part of the ELRC that I oversee. This was in addition to all of the services in the that the agency was already providing to families, from housing assistance, weatherization, EARN, GED prep, and the list goes on. But part of the work of the ELRC is to provide resource and referral to families who are applying for subsidized childcare or contact our offices looking for assistance with locating and paying for early learning programs. As we know, for low-income families or families in crisis, there are usually multiple needs that need to be met in order for the family to thrive. So referrals for families experiencing homelessness have happened both within our agency and in collaboration with other agencies. These referrals happen in both directions, from our agency to others, and then from others back to us. As Tiffany alluded to in her presentation, so much of what we do is about creating relationships and collaborating with other agencies to meet the needs of the children and families in our region. It's being willing to collaborate and bringing together multiple programs together to support families. We do have Tiffany as part of our leadership council for the ELRC, as well as various Head Start leaders. We have over 7 Head Start agencies that participate in our leadership council. In our ELRC, we have been very intentional about reaching out to local agencies like Head Start and other community resource programs to collaborate with us. Part of what we have gained through this collaboration was mapping our community assets for families and creating a community resource list. For example, many of the Head Starts in our areas were willing to share their resource guides and knowledge of those existing family supports and resources. We've also used this information in creating a virtual human resource hub that can be accessed electronically by families in our region looking for information on community assets for their families, from various early learning providers to mental health providers, pediatricians, housing, dentists, anything that they may need. Also, through collaboration with United Way of Laurel Highlands, we have expanded upon their early learning pathway brochure for Cambria County to include all of the counties we serve. This brochure highlights the options that are available to families in all of our counties. It includes Head Start, home visiting programs, child care programs, family centers, all of that are included on that brochure. Through the ELRC, we also help local agencies share information about their community resources and what programs they offer. This happens in many ways and includes electronically through social media and newsletters and virtual meetings. And prior to COVID-19, the ELRC sponsored community resource fairs for childcare providers. We seek to help our early learning and childcare programs to learn about the resources that are available to families so that they too can provide their own resource and referral to the families they serve. Thank you.
It's great. Thank you very much, Terry and Tiffany. I actually learned a lot in your few minutes of sharing with us. I think I have a full page of notes. So thank you very much. I appreciate all of that. So next up, we are going to have Tabitha. Tabitha Kramer again from our, we call ECYA Region 2. Thanks very much, Tabitha. I'll turn it over to you.
Great. Thank you so much. Can everyone hear me okay? Perfect. Okay, so well, hi everyone. It's so good to be here. I did see a lot of familiar names on our attendance today, so thanks so much for being here. So as Tracy mentioned, my name is Tabitha Kramer, and I am a supervisor at the Berks County Intermediate Unit for Pennsylvania's Education for Children and Youth Experiencing Homelessness program, also known as the ECYA program. So the ECYA program is a statewide initiative of the Pennsylvania Department of Education, and I work in Region 2, which serves Berks, Chester, Lancaster, Lebanon, Dauphin, and Schuylkill counties. And as coordinators of the ECYA program, it is our job to ensure students experiencing homelessness receive their rights under the McKinney-Vento Act and can succeed in school. And in the ECYA program, we work with school districts, community agencies, homeless service providers, students and their families to break down all educational barriers. We also work with early childhood programs in our 6-county region to make sure they have the tools they need so these students can be successful in school. And this includes educating the community, ensuring immediate enrollment, and connecting students to local resources. And as a result, these highly mobile students can have a stable education. So although the McKinney-Vento Act does protect birth to 5 students experiencing homelessness, there are some challenges to accessing early childhood programs. And one of our biggest challenges is trying to identify early childhood students experiencing homelessness. And the reality is, if you can only provide support to the students once you are aware of their situation and you can identify them. There are a lot of reasons, though, why students go unidentified. Families with young children especially are very hesitant to share their living situation because they're fearful of children and youth involvement. They're very embarrassed about their living situation, and they're also really scared that they will risk losing their temporary housing. And once we can get an early childhood student enrolled into a program, they also can face some other unique challenges. And transportation is always the biggest barrier for families experiencing homelessness and early childhood programs. And simply because most programs do not have existing transportation services to support the need. Homelessness also really hinders the child's development and ability to form attachment with their teachers and other caregivers, which can be very challenging for them to be in the classroom. And through the development of a needs assessment, where we reviewed the data and current needs in our area, our Region 2 office prioritized early childhood students. So we began to reach out to our early childhood partners like Head Start, Early Head Start, Pre-K Counts, our early intervention programs, and also our early learning resource centers in our region. And after we met with these representatives, we developed a memorandum of understanding. And in this MOU, our partners agreed to formalize our partnership to work together to offer various opportunities for these families, including an annual McKinney-Vento training for early childhood staff. And again, this is really key to ensuring that staff are appropriately identifying and referring our most vulnerable kids. We also increased identification strategies by using a residency questionnaire and enrollment packet. So again, in this residency questionnaire, it lists all of the living situations that qualify under McKinney-Vento. So it's an easy tool to include to assist with identification during the enrollment process. And the last piece that we focused on was we developed a process to provide appropriate referrals and the ability to share student information for federal reporting, which has really helped us identify more early childhood students experiencing homelessness. And speaking of community resources, I wanted to just put a plug in here for a new resource app that's coming in the fall. The ECYA resource app is currently being developed to offer statewide resources for families experiencing homelessness and other community agencies. So you should be able to see more information regarding the ECYA app. It should be coming out shortly. Also, if anyone is interested in the MOU or the residency questionnaire that I referenced earlier for early childhood students, just let me know. I'm happy to share that information with the group. And also through this process of building a relationship with our early childhood programs, we also identified a homeless liaison at all of the intermediate units. So the IU homeless liaisons have developed a process to help identify and support early childhood students experiencing homelessness. So for example, at the Berks County Intermediate Unit, we have a homeless liaison designated, but we also have program level liaisons identified in all of the early childhood and the school age programs. And the program level liaisons are really crucial in ensuring that staff are trained, but also that all educational barriers are eliminated for our students. And then as a team, we meet quarterly to assess any unique needs or challenges that the other IUs are facing. Another great partnership that Pennsylvania is piloting in is the Schoolhouse Connections Head Start referral app. So in our region, we have 6 Head Start programs and approximately 30 schools who are piloting the app. And the intention of the app is to be a direct referral source for our school districts and early childhood programs like Head Start. So in the scenario of a school-age child enrolling into school, ideally the homeless liaison would ask if there were any younger children in the home. And if there were, the liaison would ask the parent if they were interested in a referral to the Head Start program. So if they would say yes, then the liaison would submit their general information on the app. And the Head Start program would then receive an email with the referral. And it would be the Head Start program's responsibility to connect with the family to finalize the enrollment process. So Region 2 has been piloting the app since December, so we're on our 2nd month now. And through this process, I have really seen a huge increase of communication and relationship building between our early childhood programs and our school districts. So if you're interested in learning more about the Head Start app, please connect with Tracy from the Collab office, or you can also reach out to Erin Patterson from Schoolhouse Connections. I'm sure she'd be happy to assist you. So in addition to all of these identification strategies, our office also has existing relationships with all of our Continuum of Care programs, and we are able to partner with them on different activities. So the CoCs, the homeless service providers, and early childhood programs should really partner to identify and support young children experiencing homelessness. But the biggest challenge I see in this area is the difference of federal definitions of homelessness. So the CoCs use the Housing Urban Development's definition of homelessness, and schools and early childhood programs use the McKinney-Vento Act's definition of homelessness. And the difference between these two definitions is that HUD does not consider doubled up as homeless. And this can really cause challenges for these two entities. However, I have seen some great partnerships form between our early childhood programs and our CoC programs. So in Berks, Chester, and Lancaster County, the CoC programs in partnership with the ECYA Region 2 office is offering an outreach coordinator who serves as a link between school districts, homeless service providers, early childhood providers, and other community agencies. So the outreach coordinator can provide community resources and referrals. They can also assist the family with housing and childcare applications. They can meet with the family in person or virtually to assess their ongoing needs. And they can provide community outreach and information at resource fairs or other school-sponsored events like parent-teacher conferences. So in addition to that, I have also seen early childhood programs present at general coalition meetings just to simply discuss the referral process. And this way, the homeless service providers can appropriately refer young children experiencing homelessness to their programs if needed. And it also allows the homeless service providers to become aware of the early childhood resources that is available in their community. Some COC programs also have a homeless youth task force meeting. So the task force is compiled of various community agencies. I know some early childhood programs sit on those meetings as well. Housing service providers and other key stakeholders are all a part of those meetings and really assess the current needs, because this is really helpful to always make sure that children are at the forefront in everything that we do. So I really highly recommend working with your COC and your early childhood partners because it's going to help us best identify and support children experiencing homelessness. So if you need assistance with connecting with your local COC, you can reach out to the ECIA regional office. I believe we do have some ECIA staff on here. I'm wondering if someone could maybe put the map in the chat box for everyone. If not, I can do that when I'm finished here. But you can also find that information on the Pennsylvania Department of Education's homeless education website as well. So like I said, please feel free to reach out to the ECIA regional office if you need any support, whether that's connecting to your early childhood programs or your COCs. But I really want to thank you for asking me to participate in today's forum. It's always great to be a part of these trainings and to share the work that we're doing in Region 2. So thanks again, and let me know if you have any questions.
Thank you so much, Tabitha. So much great information and terrific work that you're doing. I really appreciate that. The two apps that Tabitha mentioned, one is our Pennsylvania Department of Education's app that is a resource app. I've actually been working with the team pretty closely, and it is fantastic. It's going to be really a wonderful resource for all families really that need some assistance finding supports in their local areas. So really excited for that to be live hopefully this spring. And of course the Schoolhouse Connection app, which is the referral app for Head Start and homeless liaisons. Again, really exciting, hoping to help drive a good deal of families that otherwise may not have been connected to their Head Start or early Head Start programs and connecting them, as well as to our early learning resource centers. So thanks again, Tabitha. All right, next up we have Michelle Robson. Michelle is from another early learning resource center, and that is ELRC 18. So welcome, Michelle, and I will turn it over to you. Thank you.
All right, thank you so much for having me. I'm going to try to avoid going over too much that Terry already did. And it sounds like everybody's doing great work, and you know, it's very different. I'm from ELRC 18, which is Philadelphia County. So it's very interesting to see the differences between the ELRCs and just the regions in general. I do have a small PowerPoint just so that I don't forget anything, and also so that you guys have a tool to use later on and something to reference. Again, I'm from ELRC 18. Today, I'm mainly going to talk about how we work with families experiencing homelessness and children enrolled in Head Start, and to talk about how we identify outreach to families and try to avoid duplication. We basically talked about what the ELRC does already. There are 22 ELRCs in the state of Pennsylvania. One of the main things that we do is help families pay for childcare, to understand how we work with families experiencing homelessness and those enrolled in Head Start. It's helpful to know how we help families and who's eligible for our services. So families generally have to meet work hour requirements. They have to be working or in school if they're teen parents. Through our program, they're assigned a co-payment that they pay to providers. And we also work with families who are receiving TANF benefits, and they also have to meet certain income guidelines or be under certain income guidelines. One of the big differences between families who are just coming into the program, sometimes if we have a waiting list, they may be on the waiting list for some time. But we do have a prioritized waiting list for many groups of families, but specifically those experiencing homelessness are on that prioritized group, and also children enrolled in early Head Start and Head Start. So that's something that's a little bit different between that we do as a state and as an ELRC. Also, families experiencing homelessness can get what's called presumptive eligibility. So they don't need to be meeting the work hour requirement. And this allows them time to find a job while their children are safe and in childcare. And again, early Head Start or Head Start, they do not have to wait on the waiting list. So identification and outreach, there are indicators on our applications where parents can self-report. So we talked a little bit about some fears that parents have, getting reported, and some of the hesitancy that even some staff may have having the conversation about homelessness. So there are indicators on the applications to allow parents to self-report. There's also formalized state forms that we have. We have the homelessness verification form, and then the pre-K counts verification form and Head Start verification form that providers will use to verify that parents are participating in the programs. When we are working with families, if they need help finding childcare providers, like we make referrals to them and to other agencies, we will refer them to Head Start programs if they are meeting the guidelines of the programs. We also have meetings like this to partner locally with agencies. We find that creating partnerships, especially with local agencies, helps to educate our ELRC staff and also the partner staff to understand all available resources in the community. It also creates relationships to reduce barriers to families. So for example, if they have a hard time connecting to someone, or if they have specific questions and they're afraid to ask, and they already have a caseworker that we have a relationship with, they just give us a call and we help get rid of some of those barriers and red tape and try to help them that way. We also have specific ELRC points of contact for families experiencing homelessness and those enrolled in Head Start and early Head Start. This is just for your use. This is how we're broken down in Region 18 according to zip codes. We have 3 different locations. And this is the list of our executive staff. And this, like I said, is our points of contact for many groups, but specifically families experiencing homelessness and Head Start and pre-K counts. This is my contact information and our executive director's contact information. So if you have any questions about us, how we collaborate, if you're in the area and you have specific needs, you could reach out to either one of us. But I think really the main thing that helps us a lot is local connections, and the collaboration between organizations. And I believe that my screen is not advancing, so I know that we do have a link that we could send out later that we'll share at the end, so you have these slides. But that is pretty much, so I don't repeat what Terry said, we do give families referrals to community agencies, including the Head Start and the and the organizations that support homeless families. And we are active, the agency, and in the meetings where this collaboration happens. Thank you very much. Thanks for having me.
Thank you very much, Michelle. Again, so much great information. We really appreciate it. I tried to share some information about the app, the Schoolhouse Connection app in the chat box, but I understand folks are having a hard time opening them. So we will make sure that when we send our follow-up email that that information goes along with it. There's also a PowerPoint that I know Schoolhouse Connection has said that we can share. So we'll gather up that information for all of you and get it out to you right after this. Okay, well, the last two of our panelists are Kim Smith and Jackie Holtquist from the Capital Area Head Start program. So welcome, ladies. Thank you again. And I will turn this over to you.
Okay, thank you, Tracy. And thank you to all of the prior panelists for your and your organization's commitment to engaging so effectively with the Head Start programs in your area. Very much appreciated. Jackie and I are from the Capital Area Head Start program in Harrisburg, which is the Head Start program that serves Dauphin County, Perry County, and parts of Cumberland County. We do share Cumberland County with Shippensburg Head Start. We are located in about 20 different locations throughout our service area and have a total program capacity of 1,152 children, albeit we have not been at full capacity since pre-COVID times. Our services include preschool classroom-based services for our 3 to 5 year olds, as well as an early Head Start home visiting program for pregnant women and children who are 0 to 3. I know there are several other Head Start programs on this webinar, so what I'm about to say you know quite well. But for those of you who may not be quite as familiar, in addition to early childhood education, Head Start programs provide a service model that includes health and nutrition services, behavioral health and disability supports, as well as parent engagement opportunities and family support work for families. As such, there is a whole team of people working together to support the families and the children enrolled in our programs. Jackie and I represent the family services arm to our program. In particular, we want to talk a little bit today about our attempts to engage with families experiencing homelessness and provide examples of some of the work that is done with families throughout our experience. This year in particular, 36 families experiencing homelessness have been enrolled in our program. Last year it was 25, and the year before that it was closer to 80. And that it would have been the last year that we were at full capacity. You know, we of course are very interested in recruiting and serving families experiencing homelessness, and in fact prioritize those children for enrollment spots. Included in our outreach is direct contact with shelters and housing providers, as well as other organizations who provide services to those families. As you've heard, you know, throughout some of the prior panelist presentations, the issue of collaboration and communication with community providers is so important in terms of reaching people and providing consistency of services. We, for example, do have, you know, representatives on our local, our ELRC board. We have someone who sits on the Capital Area Coalition on Homelessness, so that those networking opportunities are constantly available. As Tabitha also mentioned earlier, there is the pilot app for Schoolhouse Connections, and we are part of that pilot with the school districts in Dauphin County. So are very eager for that to be an arrangement that may help us to more effectively engage with families as well. Some of the outreach activities that have been particularly helpful for us is that direct contact with families while they are living in shelters, and actually going to shelters on site and completing paperwork with the families while they are there, getting releases signed so that we can continue to communicate with shelter staff. One of the challenges often to keeping families connected with us is the ever-changing contact numbers and sometimes locations of families. So if we can loop back to the shelter staff, they often are able to help us out a little bit. Another challenge for us has been the issue of transportation. We certainly try to connect families with the center location that is easiest and best for them as a family. Often we still struggle to help families easily get to our services. And another thing that does, interfere sometimes with families staying engaged with us is the overwhelming nature of life issues. The family experience stretches well beyond housing insecurity and often includes health and mental health factors, employment, strained family relationships. Can be really, really tough to prioritize preschool or early Head Start home visits. But once a family is connected with us, we have that really unique opportunity to support them in their goals and their challenges early in their development as a family. All families in Head Start are able to develop family goal plans, which we call family partnership agreements, which helps family identify goals and make action plans toward meeting those goals. Our family support staff engage with families on a variety of levels based on the complexity of need and the family interest in that support. Often the work we engage with families experiencing homelessness is multi-layered and complex, as you would all know. It has successes and it has pauses in success. However, the value of relationships and connections in that journey is just invaluable. And you've heard that as a theme again through all of the panel's presentations. Relationships built with the family, connections made with community providers are priceless in working through the really tough stuff. We thought we would talk you through the Head Start experience by highlighting a journey with one family. So you can see everything from recruitment and enrollment to the actual family support provided throughout the family's time with us. And at this point, I'm going to turn it over to my esteemed colleague, Jackie, to present a case scenario to better illustrate one example of a Head Start experience for a family experiencing housing insecurity. So Jackie, over to you at this point.
Thank you, Kim. Hello, and thank you for having us here today. I just thought I'm going to say the same thing that Kim kind of just said. Relationships matter. That collaboration with not only the relationship with the parents, but also relationship with the agencies really do matter in all of these cases. At Head Start, none of us are experts in homelessness, but we are experts at building those relationships, and reaching out to those agencies to help families is super important. And like what Kim said, you'll see in the story issues with transportation. You'll see issues with food insecurities that come along with being homeless. You'll see issues of clothing insecurities that come along with being homeless. All of these things are resources that Head Start staff, family support staff, can reach out and help families with, in addition to the housing situation. So about 5 years ago, our program needed some families for the early Head Start program, the home visiting program. So I reached out to a local shelter and said, to a local shelter people and said, do you have any families that you think might be good for us? And they said, yes. And we worked through that process. I went out to the shelter, I enrolled the family. I noticed that they also had they had a child who was age eligible for early Head Start, also had a child who was age eligible for preschool. So I went ahead and did that paperwork with them out at the shelter. Got to know the shelter people very well through this family, so that was great. I worked with the parents to identify some concerns. I noticed they were very strong with their family connections. They really liked the fact, one of their strengths was that they were able to live in the shelter together as a family. And this was a high point and a strength, and that kind of built the relationship from there. So at that time, mom was working outside the home and dad stayed home with the kids. So the home visitor worked a lot with dad, and we noticed along the way that dad had some mental health issues. We encouraged them to get into counseling and work with the case management unit and get some mental health counseling for him. The home visitor worked with them on some housing goals and some other goals. We encouraged them with other resources that they might need. They did not, they had just joined the shelter from being homeless at a shelter that moved from church to church. And then when I met them, they were in a shelter that was a more like a transitional, more permanent. Every night they stayed in the same place. So they didn't have a backup of clothing. And, little kids change clothes all the time, but parents also, if you're homeless, you don't take your clothing with you from season to season. You don't have the space for that. So we worked through some resources for that, help them get copies of birth certificates so that they could get on the housing list. We also encouraged, which we do, through Head Start. Those of you who are with Head Start know this. We also encourage them to get evaluations, early intervention evaluations done for their children. We started helping them fill out that paperwork. Was able to do it in their home, in the shelter, and be able to be a calm space for them. And the home visitor helped with that. As we worked through with them, the older child transitioned onto preschool with IU supports. The younger child worked with early intervention, and then mom became pregnant with a third child. The family support worker helped them go through some different apartments, tried to help them, show them how to search for apartments on the internet. They were able to find housing through the internet and the support of the family support worker. We then supported them with household needs. We worked with them to use community resources for food and clothing, talked to them about using the LIHEAP to keep their bills under control. Unfortunately, a year and a half later, dad is now working temporary jobs. Mom is pregnant with a fourth child. So the income is not as steady. Recently, unfortunately, they lost their apartment, and we connected them with the homeless assistance program in Cumberland County, which a member of that team is on the call. I invited her to join the call today, so she's here with us. And so she connected with them. We did some Zoom calls because, of course, it's COVID. We did some Zoom calls. She supported them with different ideas and brainstorming ways to deal with the current situation. Right now, they have not found a stable place. They're doubled up with some friends, but we were able to help them with, searching for employment options. And again, like today, I will be able to take them some resources for some food because they're having some needs for food. We were able to, mom was concerned, she's staying with friends. They live out of town from the children who are now in elementary school age children. She was concerned for their education. We made sure that they understood about the transportation and helped them reach out to the district and tell them what was going on so they could provide transportation so the kids didn't have to switch schools. It's a whole cycle, and we're going to support them because mom, one child is going to transition onto preschool this coming fall, and mom is having her fourth child. So we will support her through the early program again and try to get them back as quickly as we can with as many supports as we can to get them back in a more structured living situation, more stable living situation. But I kind of just to highlight again, all of the different issues that came up with this family, whether it was food or clothing or housing or developmental issues that the family was dealing with, mental health stress. This is kind of a package deal for a lot of these families. And that's why I feel Head Start is so important. Kim mentioned that Head Start provides all of these resources for families, not necessarily, provide medical services, but we can connect you to medical services. We don't provide housing, but we can help connect families to those resources. And to me, that is just so important. And just thinking back through this family, again, today, I'm taking them some more food resources that we were able to get for them. And I think that, and that's really important. We're there for them. And this family knows we're there for them and have supported them for the past 5 years since we met them. So we're going to encourage them and we're going to help them. And they will find another place to live and it's going to become stable again. And we'll help them through that. So I do think, just knowing all of your resources and keeping in your mind all of those stressors that are happening. You know, it does affect attendance, it does affect a lot of things in your programs, but being housing insecure really affects the mental health on top of all of these other things. It affects the parents' mental health, their ability to get up in the morning, the ability to get their kids to school. So keep that in mind when you're talking with families, which I'm sure all of you already know that are on this call. We all are caring people, or we wouldn't be on this call. But thank you all so much. It was really interesting listening to everyone today.
Thank you again, Kim and Jackie. I'm a broken record, but once again, that was fantastic information. I really appreciate it. So we've got a little bit of time here, probably about 10 minutes to take some questions, try to provide the answers. If, you know, somebody, hopefully, if not one of the hosts, somebody on the call can certainly help provide some answers. Before we do that, though, I encourage you now, we did see the questions in the Q&A part of the Zoom. I believe many of them or all of them may have been answered. And I know someone in the chat box also asked if we were going to discuss transportation, which I think probably we would all agree is the biggest barrier. So we can start with that, but I really encourage you to put any other questions or comments into the chat for us so that we can make sure we get to them. I also just want to add quickly, in case I don't have a chance to later, we are collecting all of the requests within the chat box for certain materials that folks have talked about today on the call. We will gather those and share those with you after the call. I also will offer, Dr. Whitney and just did a really fabulous, actually she's done a few of them, community of practice for our ECYA and McKinney-Vento liaison partners across the state. And so I've taken all of the resources that she shared in her PowerPoints and put them into like a 2-pager that you can keep very handy on your desktop or someplace to access. So I'll grab that as well and make sure Joe has it to share with all of you. And if you're not familiar with the 9 interactive learning modules that are on the Early Childhood Knowledge and Learning Center website, they are fantastic for folks who maybe need sort of like the baseline educational elements around young children experiencing homelessness and serving them. We will certainly make sure that we get the link to those modules into the information for you as well, because they are really fantastic training opportunities that are also in our at the Pennsylvania Key, our professional development system for training for childcare and early learning programs across the state. So we'll make sure you get plenty of resources outside of those that we've talked about today. All right, so somebody would also like the PowerPoint, and we will make sure that we get you that and the information about the presenters as well, Joe. So that's in the chat box. So I guess maybe the first thing to try to have a discussion about might be transportation. And I will say I talked to certainly all of the Head Start not all of them, most of the Head Start grantees on a weekly basis. We have a weekly call. I speak to the ECYA folks quite a bit, Tabitha and all of her colleagues. We've recently had an opportunity to speak to a number of McKinney-Vento liaisons across the state and all sorts of folks that are working on issues surrounding homelessness. And I have to tell you, the number one barrier every single one of them without exception talks about is transportation. So certainly we are aware that that is a barrier, and I'm really curious to hear from anyone who's with us today if you have some solutions that have worked or some strategies that maybe you're trying to employ. Any suggestions for maybe some success stories that you may have?
I'll
And you
jump
can-
in here, Tracy,
Thanks,
if that's
Tabitha.
okay, just to share some things that I've seen successful. I think sometimes it's challenging because one method may work for one family, but it may not work for the next family. So when we're talking about transportation, I always like to remind everyone that it doesn't necessarily have to look like a yellow school bus. And I think sometimes a lot of people think that transportation has to be a bus, but it doesn't. So sometimes it could be about providing the family with a bus pass, maybe gas cards if they have the ability to transport, or maybe they have family members or friends who are willing to transport and you can support the family member with gas cards. I've also seen programs provide travel reimbursement, but also partnering with their school district. So maybe there's a school-age child and they could pick up the Head Start or early childhood student and take them on the bus. So again, those are just some things that I've seen be successful, but again, it's not always an easy fix depending on what your community looks like and what supports the students or families' needs.
Thank you very much, Tabitha. Hopefully that was helpful to folks thinking outside of the box a little bit. Joe, did you have something you wanted to ask the panelists?
Sure. I was wondering if anybody has seen any movement on the American Rescue Plan dollars that are supposed to be coming into either the ECIA system, the homeless housing system, Head Start specifically, and any other programs that you might be tapping into. Now, those funds haven't hit your county yet? Tells us we got some policy work to do. Yep.
Anyone in the audience, there we go, that may want to put something in the chat. Home ERP funding tomorrow. Okay, so we're still, maybe it looks like maybe we're still in the planning stages for some of those dollars. All right, any other questions from the audience? Please put them. Thanks, Kathy, very much. I appreciate that. It's good to know. I would like to ask, oh, wait a minute, sorry. Struggle with transportation in a rural area, lack of driver's licenses being suspended, inspections and registrations that they can't afford. Yeah, so some of those, those issues that Jody just mentioned in the chat box, I'm wondering if providers, Head Start programs or other providers in local communities have either the ability themselves through their program funding to support some of those needs, such as, you know, helping a family. I know Head Start can help families get things like driver's license, you know, or if their license has been suspended, helping them figure out what steps they may have to take in order to get that back. Inspections and registration. Sometimes it's a matter of helping them, bringing them in, letting them use the computer and helping them get through the process. And if you are in fact, if you do have dollars that you are permitted to use to assist families with things like that, then many of those smaller, I'll call them smaller barriers, they're not small to our families, but they're reasonably easy, right, to overcome, then by all means, if there's something you can do within your program or you have someone you can refer them to, that would be a great asset to those families. Funds in our region are largely going through our intermediate unit. They've started their planning process with participating schools. Some of the funds used to hire student support specialists to build capacity at schools for identification and service connection. That's great. Student support specialists. I'd be curious to learn more about that role. Brian. Maybe we'll be reaching out to you to hear a little bit more about that.
I know in our region, we've used some block grant funding for a vehicle assistance program. However, we do have a large wait list, I believe, right now for that program. Transportation is one of those things that continues to be a challenge in the rural areas. And sometimes with housing, if it's located out of an area where there's any kind of public transportation, that can be a barrier.
Thanks, Brian. Wow, there are some great resources here in the. I have a quick question. I'd love to hear some discussion about, but I just have to say, my computer won't stop sending me messages that it's going to restart in 10 minutes, which is about 11:28. So Joe, if I disappear, you're gonna have to take over for those
Gotcha.
last few minutes.
Mhm.
Thank you. I apologize for that. I don't know why it's insisting on restarting, but the snooze option is no longer available to me. So thanks. My question is, I guess I'm just eager to hear from others about doubled up folks. So I have found that to be, as I do different trainings or maybe talk with Head Start grantees, oftentimes in rural communities, I think that the identification of families that are meeting the McKinney-Vento definition due to their doubled up status, I find that program staff often have difficulty having those types of discussions with families, and being able to really identify them and getting them additional supports. And I'm wondering if any of you share the same experience, not just those of you on our panel, but others that are with us. If you could, put some comments in the chat box, that would be great.
And for our folks on the panel, does anybody have an experience with trying to develop a strategy to reach out to doubled up families?
Yeah, I would agree that I think the majority of our families who are homeless are technically doubled up. They're not necessarily living in emergency shelters. We do try to flesh that out in a conversation during the initial application, because obviously the family gets prioritized if we can determine that they are homeless. So that is a conversation that our enrollment specialist tries to have as they go through the list of selection criteria. And certainly we understand that families may be reluctant to engage in that kind of conversation at a right out of the gate conversation, but that is our first attempt to do so.
I agree with Kim. A lot of it has to do with the conversations that we have with parents and the things that they say when they say that they're living with someone. Then we sort of expand on the conversation and try to understand why they're living with someone and who they're living with, and if it's a temporary situation, because a lot of parents are resistant and, and some staff are not comfortable either. So, we really try to work with staff to get them to a point so that they can do that and have those conversations comfortably.
Great, thanks.
We're very fortunate. We have some flexible funding that can serve doubled up. With ESG, if we found if they're doubled up with somebody and they're on housing, they're no longer allowed to be there. Therefore, they would qualify for HP if they would have an eviction notice from that person.
Right, that's often a barrier. Because due to the circumstances that they're living doubled up in, not only would they then lose their housing where they're staying, but the host that's hosting them would in turn lose theirs as well because of rules about allowing others to stay. Yeah, that's a big barrier from what I understand from programs.
And Michelle, were you in that conversation a couple of weeks ago? We were talking about during the enrollment phase of using not the word homeless, but something like McKinney-Vento eligible. I don't know if you were in that conversation. I know some of the schools are starting to try to embrace that.
I vaguely remember that
Mhm.
conversation, so I think that's something that could be helpful.
Right, so I think a lot of our systems have a challenge. You ask a family, are you homeless? A lot of people are going to say no because of the stigma attached to that. So I know some folks are adjusting and trying to say things like, are you McKinney-Vento eligible? And most people say, what's that mean? And then you can talk about, the housing situation.
Yeah, that's a really good point. I know the wording we've tried to use is, are you experiencing a housing transition right now? For example, are you staying with someone else right now? Or are you not able to be in your own home right now?
Yep.
One thing that I've found to be really beneficial is I know we offer a lot of trainings to community agencies and early childhood providers on McKinney-Vento and, but I also think it can be very important to do training for families themselves. And we've done that before in partnership with our migrant program. So I know we've had translators there for them, but letting them know that because of your housing situation, these are the rights that you have. So that I think is really important. And just to add what you were saying, Joe, other words that we always highly suggest other than using homeless could be in transition, like Kim said, displaced, McKinney-Vento, eligible. So I think these are all really good, ideas to keep in mind, but also partnerships and building trust with these families is going to be key to having them sharing the information that you need them to, so you can identify them under McKinney-Vento. I think that's all important to keep in mind.
That's a great point, Tabitha. And I think something that Head Start programs in particular excel at, and that is building those necessary relationships with families. I think also, and I know a lot of programs do this, but when you're talking with a family at enrollment, for example, rather than sort of the stereotypical clipboard with the questions and checking the boxes, more open-ended questions. Tell us about your housing situation, right? What is your address? Does anybody else live there? And just letting them describe it to you in their own words so that you in turn can kind of then maybe be a little bit curious about what that looks like for them and, explore more what that exact situation is. And then it's not as nerving or fear, it doesn't necessarily instill fear. You're not throwing out words like homeless. And it really kind of gets you all of the information and the answers that you're looking for. Housing instability. That's great. Thanks, Melissa. Yes. Anyone else have questions or comments? This has been a great discussion. Thanks, Brian. Yeah, letting people describe things in their own terms and mirroring what they show they're comfortable with. Yeah.
Some of the materials we will share with everybody in follow-up emails to everyone today. We'll take out the comments and suggestions in the chat function and package it so it's readable and get that out to everybody. It'll probably take us about 2 or 3 emails over the next 2 weeks to get all this out, including the recording and some of the materials that were shared with today.
I'd also just very quickly before I get kicked out and before we end, I just want to offer an invitation. I will quickly here put my email address in the chat box also. It's in the PowerPoint, but I'll put it here. If you're interested in being a part of some of the work that we're doing at the state level between Joe and myself with the Collab office and People's Emergency Center, that, you know, we have committees, we have a statewide stakeholders group. There are certainly plenty of opportunities that we can talk with you about to be sort of a part of some of these larger statewide groups that are working hard to implement some much needed strategies and changes. So if that is something that you think you're interested in, please reach out to me.
It looks like her computer has timed her out, but that's good timing because it's 11:28 and we should wrap up and get going because we let everybody know we'll be done by 11:30. So unless any of the panelists have a final comment or question, I'd like to thank everybody, especially the panelists, for preparing their comments for today. And I want to thank all the participants for showing up today. And thank you for all the work that you do for children, not only children experiencing homelessness, but all children and all. Everyone is doing some great work. This is a group of people. I think we all like to hang out with each other and all. So very grateful you spending time with us today. Let's stay in touch and keep up the good work, everybody. Take care.